Okay, ladies, so now we're going to move on to chapter 25, and this one is drugs used to treat peripheral vascular disease. So the learning objectives for this chapter are to describe the baseline assessments needed to evaluate a patient with peripheral vascular disease, identify specific measures that the patient can use to improve peripheral circulation and prevent the complications of peripheral vascular disease. Also, to identify the systemic effects to expect when peripheral vasodilating agents are administered, and to explain why hypotension and tachycardia occur frequently with the use of pentoxinfenil and silostazol, and to be able to cite both pharmacological and non-pharmacological or drugs and non-drug goals of the treatment of peripheral vascular disease. And now I am going to be on slide number 4. So, peripheral vascular disease is a disease of the blood vessels in the extremities. It can be arterial or it can be venous. So, with arterial, there can be obstruction, there can be vasospastic, there can be a primary reason, which maybe have an unknown cause, and there can be secondary, which has usually known triggers. For venous, vascular disease is deep vein thrombosis. So the primary cause of arteriosclerosis obliterans is buildup of atherosclerotic. I'm sorry, y'all. I just got these things and they just messing with my speech because it's making my mouth water. But okay, so primary causes of atherosclerotic obliterans is buildup of atherosclerotic plaque, resulting in narrowing of the lower aorta and the major arteries that provide circulation to the legs. So, peripheral vascular disease symptoms occur with significant narrowing in the blood vessels. So, the patient may experience aching, cramping, tightness, weakness during exercise. They might experience ischemia or lack of blood to tissues occur, meaning there's no blood flowing through those blood to the tissues. They may have pain results from lack of oxygen to the muscle, and it progresses to pain at rest, numbness, and paresthesia, which is numbness with tingling. Blood often becomes more viscous or thicker. Viscous means thicker. Patients tend to remain free of symptoms until there is 75 to 90% occlusion in key locations of the major arteries and arterioles of the leg. Again, patients tend to remain free of symptoms until there is 75 to 90% occlusion of that vessel or arterioles of the legs. So slide number 6. So, Raynaud's disease. Raynaud's is caused by vasospasm and ischemia of arteries in hands, fingers, and toes. Signs and symptoms are numbness, tingling, skin tightness, blanching of the skin with vasoconstriction followed by vasodilation. It begins with the fingertips, then the hands. This was one of those that when we talk about classic textbook diseases and disorders, this is one of them. And if you look at the picture, I mean, it's like all the blood flows out of the fingertips. So it starts with the fingertips, and then it moves down the hand, and the same thing. It starts in the toes, and then it moves up the foot. It's like the arteries vasoconstrict. So when you ain't getting any color in the fingertips and the toes, that means there's no blood circulation going there. So those is one of those classic, if you ever see it. So treatment for peripheral vascular disease, the goal is to reverse the progression of atherosclerosis, improvement of blood flow, and prevent pain, prevention of skin ulceration, and prevention of gangrene. Was there a picture of gangrene on that first slide? Oh, I think that was on. No, it wasn't this one either. It might be on the slide coming up. So I'm moving on to slide number 7. Oh, let's see. Sorry, ladies. Slide number 8. So, slide number 8. So, non-pharmacological treatment or peripheral vascular disease, meaning not necessarily using prescription drugs or any drugs of any kind. So we want to get that diet control. We talked about that. Reduce that hypercholesteremia. So we want to get the cholesterol level down. Daily exercise and weight control. Stop smoking. Control of your diabetes and hypertension is huge. Because you'll see, especially your diabetes, there often can be poor circulation, so this is linked to that. Proper foot care, especially for diabetics. Foot care is huge. Always want to be monitoring those toenails, the toenail color, and things like that. And often diabetics, or at least diabetics I have serviced or taken care of in the past, will seek some kind of podiatry care, or that's a foot doctor. Elevation of the head of the bed to increase circulation to extremities, arterial angioplasty, and surgery. So, Raynaud's disease is best treated by avoidance of triggers, which is often cold temperatures, emotional stress, and tobacco and other drugs known to induce the attacks. So, I'm moving on to slide number 9. So drugs, therapy for peripheral vascular disease, approved by the FDA to treat intermittent claudation due to chronic occlusion, arterial disease of the limbs. So Trental, hemorrhagic agents, enhance our red blood cell flexibility. Pletol is a platelet aggregation inhibitor. So even though pharmacological therapy is added, non-pharmacological therapy measures must still be implemented for optimal benefit. Non-pharmacological treatment is more successful in treating the underlying disorder. So we need to get our patients to be compliant with their health care. So education is huge. So it goes back to, get them to control that diet, exercise. If they're smokers, to stop smoking. Control their diabetes and their hypertension. Proper foot care, especially for diabetics. And elevation of the head of the bed to help increase that circulation down to the extremities. Okay, let's move on to slide number 10. So, classes of drugs used to treat Raynaud's disease. So, those might be calcium ion agonists. So, cardizem, procardia, verapamil. And then there's the adrenergic antagonist, which is minipress, ACE inhibitors, and direct vasodilator, nitroglycerin, or then you might see it called nitrobid, nitrodur, nitrostat. So let me see. I was trying to look at my notes here. So nifedipine is the calcium ion agonist with the greatest success in reducing occurrence of spasms. Captopril has been extensively studied and successful in reducing frequency and severity of attacks. Adrenergic antagonists have moderate success and many adverse effects. Nitroglycerin has adverse effects such as dizziness, headache, and hypotension. So, slide number 11 talks about assessment. So, we got to get that history. What's the risk factors such as hypertension, high serum lipids, cholesterol? What's their dietary habits? Are they obese? Do we need to adjust those dietary habits? Smoking, is that a concern or issue? We need to work on cessation. Assessment of the tissues, oxygenation, temperature, peripheral pulses, and limb pain. And what's their level of exercise tolerated and ability to control stressful situations? Assessment of tissues include oxygenation, temperature, edema, peripheral pulses, and limb pain. Okay, so let's see where we are. Slide 12 is a question. Slide 13 is a question. Slide 14 is a question. And we're going to move on to slide number 15. So, we're going to work on education with our patients to help them have optimum health. So, education for PVD. Self-care measures that promote circulation. But everything to get that circulation moving as much as possible. Smoking cessation. If we need to help them get resources to help them get into the smoking programs to help them quit smoking. Avoid tight-fitting clothes. Tight-fitting clothes cut off circulation. Diet designed to control obesity and the cholesterol levels. Check the extremities for infection and meticulous care. Avoid sitting or standing for long periods of time. When patients stand and they have this condition for a long period of time, sometimes the blood like to pool, but that doesn't necessarily mean they're getting good circulation. So that can become a factor if they're sitting or standing for too long. Maintain and foster maximum mobility, so as much as they can do for themselves and move around. And medication education and expectations. The expectation is for them to be compliant. And the more compliant they are, or the better compliance they have, the better their health is going to be. So check with the healthcare provider before elevating extremities. It is contraindicated in patients with arterial insufficiency. So that's something you might want to check with the provider before you instruct the patient to do that thing. Before elevating extremities, check with the provider because it may be contraindicated in patients with arterial insufficiency. And have the patient set short-term goals to control pain and symptoms. Because if they make the goals too big and it don't happen, they may get discouraged, and that also may contribute to them not being compliant with their health regime. So, help the patient set short-term goals to control their pain and their symptoms. So, slide number 16 talks about patient teaching. Test the water temperature before immersing your hands and feet into it. If it's too cold, you have to remember, cold temperatures is a trigger for Raynaud's. So tell the patients to make sure they checking the water temperature before getting into a bath or a shower, washing their hands and things like that. They need to alternate pairs of shoes to allow a pair to dry so that the moisture is not causing the issue. So alternating shoes. They can wear several layers of lightweight clothing to avoid frostbite. Drug therapy isn't total solution. So they do have to do some of these non-pharmacological actions and educational teaching to help contribute to improving their health. Okay, slide number 17. So now we're going to move into some of the drugs that will help with peripheral vascular disease. So hemorrhagic agents. Drug is Trental. Heparin is also in this category. This class of drugs help increase erythrocyte flexibility, decreases the amount of fibrinogen in the blood, which prevents aggregation of red blood cells and platelets. Is used to treat intermittent claudication. Common adverse effects is nausea, vomiting, dyspepsia, dizziness, and headache. Serious adverse effects is chest pain, dysrhythmias, and shortness of breath. Note that decreases the velocity of blood, or they also decrease the velocity of blood and improve tissue perfusion, which results in increased blood flow. So if it improves tissue perfusion, it helps to increase the movement of fluids through the circulatory or lymphatic systems to the tissues or organs, okay? Slide number 18 is a question. Slide number 19 is a question. Slide number 20. And you all can answer these questions and bring them to class. Tuesday when we have our Q&A, we can go over them to make sure you pick the right answers, or we can discuss them in a little further detail, okay? So another class is, and I'm on slide number 20, is platelet aggregation inhibitors. A common med in this class is Pletal. The action of this drug is that it allows increased levels of CAMP, which results in vasodilation and inhibit platelet aggregation, meaning clumping of the platelets. It's used to for treatment of intermittent claudication, and adverse effects are dyspepsia, diarrhea, dizziness, and headache. Serious adverse effects is chest pain, palpitation, dysrhythmias, and shortness of breath. So therapeutic outcomes. This improves tissue perfusion. Remember the movement of the fluids through the circulatory of the lymph system or the lymph system to the tissues or organs. So it's getting it out there. It reduces pain. Okay, so we're back at therapeutic outcomes. It improves tissue perfusion, meaning the blood can get in there. Reduce pain, improve tolerance of exercise, and improve peripheral pulses. And slide 21 is questions, so please come with your questions. This concludes chapter 25 on drugs used to treat peripheral vascular disease. And we have one more chapter to go. Okay, ladies.